Diabetes is a chronic condition that affects how your body turns food into energy. Normally, when you eat, your body breaks food into glucose, a form of sugar that enters your bloodstream. When blood sugar rises, your pancreas releases insulin, a hormone that helps your cells absorb and use that sugar for energy. In diabetes, that process breaks down. Either your body doesn't make enough insulin, doesn't respond to it properly, or both. The result? Sugar stays in your blood, and over time, that can cause serious damage. There are two main types, type 1 and type 2. They share some similarities, like high blood sugar, the need for blood sugar monitoring, and the risk of long-term complications, like nerve damage, kidney problems, and heart disease. But they're very different in how they start and how they're treated. Let's start with type 1 diabetes. Type 1 is an autoimmune disease. That means your immune system, which is supposed to protect you, attacks and destroys the cells in your pancreas that make insulin. Once those cells are gone, your body can't make insulin anymore. At all. That's why people with type 1 need to take insulin every day through injections or a pump for the rest of their lives. Type 1 usually starts in childhood, teen years, or early adulthood, and the symptoms can appear suddenly. Things like constant thirst, frequent urination, extreme fatigue, and unexplained weight loss. Without insulin, it can lead to a life-threatening condition called diabetic ketoacidosis, or DKA. Type 1 can't be prevented, and it's not caused by diet or lifestyle. It's likely a mix of genetics and environmental triggers, but the exact cause is still unknown. Now let's look at type 2 diabetes, which is far more common. In type 2, the body still produces insulin, at least in the beginning, but the cells don't respond to it properly. This is called insulin resistance. The pancreas tries to compensate by making more insulin, but eventually it can't keep up. Type 2 usually develops in adults over 40, but it's becoming more common in younger people, even kids, mostly due to rising rates of obesity and sedentary lifestyles. The symptoms are slower to appear: tiredness, blurry vision, frequent infections, slow healing cuts. Sometimes people don't notice anything at all. And here's the key difference. Type 2 is heavily influenced by lifestyle. Diet, exercise, weight, and stress all play a role. That means it can often be prevented or delayed. Now let's talk treatment. For type 1, treatment is straightforward but constant: insulin therapy. You take insulin every day, calculate doses based on what you eat, check your blood sugar regularly, and adjust for things like exercise, illness, or stress. You might use a continuous glucose monitor, or CGM, to track your levels in real time, and an insulin pump to deliver insulin automatically. With type 2, treatment usually starts with lifestyle changes: eating healthier, being more active, losing weight. Doctors may also prescribe medications like metformin, which makes the body more sensitive to insulin. There are also newer medications that help the body eliminate extra sugar through urine or stimulate insulin release. In some cases, especially later on, insulin therapy might also be needed. But whether it's type 1 or type 2, there's a common goal: keep blood sugar in a healthy range to prevent complications and feel your best. So, what should you do if you've been diagnosed? First, don't panic. Millions of people live full, active lives with diabetes. The key is consistency and support. Learn your body. Understand how different foods, stress, sleep, and movement affect your blood sugar. Build your team: a doctor, diabetes educator, and maybe a nutritionist. They'll help you personalize your care plan. Monitor your blood sugar as often as your treatment plan requires. That might mean daily finger sticks or using a CGM. Take your medication, insulin or pills, exactly as prescribed. Don't skip doses, and don't adjust them without talking to your provider. Move your body. Regular physical activity, even walking, helps your body use insulin better and lowers blood sugar naturally. And of course, let's talk food. What should you eat? Focus on whole, unprocessed foods with a balance of carbs, protein, and healthy fats. Choose high-fiber carbohydrates that digest slowly, like whole grains, vegetables, legumes, fresh fruits in moderation. Add in lean proteins, like fish, chicken, eggs, or tofu, and healthy fats from nuts, seeds, or olive oil. Eat meals at regular times to help your body regulate blood sugar, and drink plenty of water. And what should you avoid or limit? Try to avoid sugary drinks like soda or sweet tea, refined carbs like white bread, pastries, and processed snacks, fried foods, anything with trans fats or excessive saturated fat. Be careful with low-fat products that are loaded with sugar. To make up for the taste, always check the nutrition labels, watch portion sizes, especially with carbs, and learn to read your body's response. Also important, sleep and stress. Poor sleep and high stress raise blood sugar levels. Aim for 7 to 9 hours of quality rest, and use tools like deep breathing, stretching, or meditation to manage stress. Finally, remember, you're not alone. Diabetes is a challenge, yes, but it's a manageable one. With knowledge, habits, support, and the right tools, you can live a healthy, active, and fulfilling life.